Go ahead, sir.
Thank you. A very good afternoon to every one of you, and wish you all a very happy Diwali from myself. I'm Dr. Nilesh Balkawade, Clinical Head, Oasis Fertility, Pune. I wish you all a very happy Diwali to all my friends, patients, and colleagues. Today's topic is related to Diwali. It says lighting the lamp of fertility. Fertility is a journey, and when it doesn't occur, so we call it as infertility. Trying for 1 year if you are aged less than 35, or a woman whose age is more than 35 and trying for more than 6 months, we call that as infertility. Now, once you're facing a problem of infertility, it can be tiring and emotionally demanding for you as well. There can be darkness around you where you may not find a path where you want to go. You may not find the way which leads to the destination. So, the topic for today is lighting the lamp so that you find the light in all this darkness of infertility. So, we start. Can we have my presentation? Friends, difficult roads often lead to beautiful destinations. So, it may be very difficult for to you initially, but it's generally rewarding once you find that road and you are through to your destination of childbearing. Infertility was a problem, it is a problem, and it will remain so a problem. In spite of India being the most populous country, amongst the most populous country world over, we know that infertility problem still exists in India, and 1 in 6 couples faces the problem of infertility. The services of infertility which are taken by the couples are not to that extent. So still there remains a lots of patients who don't avail any fertility services. Advanced fertility options or infertility treatment started somewhere 40 years ago with the advent of IVF. When Louis Brown was born in London with the efforts of Steptoe and Edwards. Around the same time, 40 years back, Dr. Subhash Mukhopadhyay from India invented the process of IVF in India and gave birth to the first baby, IVF baby of India called as Durga or Kanupriya Agarwal. From there till now, there have been phenomenal advances in infertility treatment, and therefore, the light which was shown by the scientists is now leading us to the path where we can find answers to this problem. However, some patients can still have bigger problems, and therefore, the research is also going on so that we have problems and solutions to most of the patients which come to us. Initially, the success rates ranged from 66%, now they have gone to 60%. Failure still remains a fear. Multiple pregnancy is still a problem which can be encountered while taking fertility treatments. But friends, our goal of infertility treatment or showing us the path is to have minimal deviation from normal. It should be an economical treatment with minimal side effects, eliminate human error. There should be good diagnosis and prediction, picking the best gamete and embryo. Those options or those advances are also going on, and shortening the time to pregnancy is again an important aspect of treatment when it comes to infertility. What all we have in our basket, so that these are the new treatments which can show us the way. One of this is computerized assisted semen analysis or the CASA. So subject to variation in semen analysis has been brought down by the use of computers, and this computer assisted semen analysis has paved the way to form uniform reports throughout the world. We have a major bulk of infertility problems as male infertility, and almost 40% of the infertile couples coming to us have the problem of male infertility. Friends, the sperm selection is very important when it is related to IVF or ICSI. So These sperm selection techniques have had a great advance in the last 1 or 2 decades. Initially, we used to do a washing by simple wash or gradient centrifugation. Now, there are multiple methods available which can do a good sperm selection with less sperm damage. So, magnetic cell sorting or MAX, microfluidics, or selecting the best sperm by the sperm motility, uh, IMSI or morphological sperm selection, and PIXI or physiological sperm selection. All these are techniques which can improve our success rates of IVF and ICSI. Another dark area where the treatment can be considered difficult, or where the couples usually find that this can be a problem and I may not be able to conceive anytime with my own gametes, is azoospermia, and for that matter non-obstructive azoospermia, where the testicular function is deranged and there is testicular cause of azoospermia. So these patients who have high FSH value and testicular cause of azoospermia, in these patients, microsurgical testicular sperm extraction or microTSE can be undertaken, and the seminiferous tubules which have good sperms can be uh, exposed under the microscope, selected, and then these tubules can be analyzed under the high power magnification, and sperms can be selected from these. Friends, even if you find a single sperm in this technique, the option of single sperm freezing or single sperm vitrification by using sperm VD device is available nowadays, which was not available previously. So a 2 microliter microdroplet can freeze the sperms and this can be stored. And the sperm retrieval is excellent when we are using a sperm VD or vitrification device. There are few future prospects for sperms where sperms can be produced outside the lab by genetic engineering. So these are also being tried. Like the sperms, the problems with the eggs or oocytes can be there, and therefore, while doing IVF or ICSI, polarized microscopy can be used for selecting the best oocyte out of the lot by polar birefringence technique. Sometimes we can have immature eggs, and therefore we have in vitro maturation, which can be used for patients of PCOS, ovarian hyperstimulation syndrome, where we want to reduce the cost of IVF. It can also be used for fertility preservation. Oocyte and ovarian tissue cryopreservation are another techniques which help in preserving fertility for the future, especially in cancer patients or in social freezing. In vitro activation or ovarian rejuvenation is a form of treatment where the oocytes are depriving very fast. So it can be a case of premature ovarian insufficiency or early menopause, or cases where donor eggs may be advised. So in these patients, in vitro activation or ovarian rejuvenation can help to an extent, and these are the future prospects. Culturing embryo outside the body was always considered an important aspect of IVF treatments. Initially, we used to do that in a very large box using lots of controls, but nowadays we started using benchtop incubators, which are now gradually shifting to individual patient benchtop incubators, where we can see the embryo on the television screen via embryoscope. So this is the advances which have been taken place in the embryo culture. This is how we can see the images of the embryos on the computer screen, and we can analyze which embryo is the best based upon the technique or the growth of the embryo. Selecting the best embryo for embryo transfer is another important form of research which is undergoing, and therefore this can also increase our success rates in infertility patients. So, choosing the best embryo by blastocyst culture, vitrification, PGTA, time lapse, or by use of omics is another treatment. Friends, when it comes to clinical aspect, it's another important aspect of infertility treatment is the IVF lab, where smart lab can help us to achieve phenomenal high results. So in Oasis Fertility, we have class 10,000 lab where all the parameters are checked multiple times, and we have a QA/QC, that is quality assurance and quality control of the embryology lab, being undertaken very frequently, and therefore we can keep the class 10,000 standards as a standard for our treatment. Friends, Artificial intelligence is coming up a long way in many fields, and so it is in the field of medicine. So once we want to predict a chance of viable pregnancy, we can use artificial intelligence by detecting the best quality embryo. So fetal heart probability of each embryo can be analyzed based on computer generated models, and this has also revolutionized our treatment plan. So the journey so far is, fertility preservation, mm, three parent baby, pre-implantation genetic testing, stem cell therapy, in vitro gametogenesis, and designer babies. The sky is the limit when it comes to research. Man machine has already landed on the moon. So there is nothing which is impossible. So what was initially thought was of impossible has already become possible, and that future is going to be a great one for infertility treatment as well, where we may be able to grow designer babies, where we may be able to grow the baby completely outside the womb, and so on and so forth. So friends, uh, this is about the recent advances in infertility management, and there is always a ray of hope, always a light at the end of the tunnel where we can go for the treatment. So, this is all these things are going to help us if we do it in a methodical way. So, not every treatment is going to be useful for each and every patient. There are going to be pros and cons. We have to outweigh them and select the best treatment for uh, our patients. So that's how we go about it, and therefore we have this newer treatments which can be a ray of hope for many of our patients. So thank you for watching today's session, and here we lead the light from the darkness, and we may have answers to many of the queries which were left unanswered because of inadequate research. So research is going on to give success to maximum number of patients, and we are hopeful that we'll be able to satisfy most of our patients. Thank you for your patient hearing. If you have any questions, please do write in the comment box. And if you want to contact us, it's given our helpline numbers are given below. Yeah, the first question coming up to me is CASA test accurate? So CASA is computer assisted semen analysis. It will help us to give the objective assessment of semen, so that there is no variation in between two subjects measuring the test, and therefore this is definitely going to be helpful. And yes, it has now been proven that CASA is fairly accurate test when once it's the stat all these parameters are properly analyzed, and we have the uh, algorithms inbuilt which have a larger base for algorithms, then we definitely have CASA which is going to be more and more accurate. Yeah, so CASA test is taken when you are going for infertility management, and this infertility treatment is going to the first test which is going to be told is the semen analysis, and therefore CASA test is the one of the first tests which you will undertake while you are going for fertility treatment. What is ICSI? ICSI is intracytoplasmic sperm injection. It is an advanced form of IVF treatment where or artificial reproductive techniques where egg and sperm is taken out of the body, and the fertilization process is completed by injecting the sperm into the cytoplasm of the egg. This is called as intracytoplasmic sperm injection, after which embryos are formed, and embryos are prepared outside the body, grown outside the body for 3 to 5 days, and then inserted inside the womb. How long does it get to take to get pregnant with ICSI? So ICSI is a process of is a part of IVF process. So usually we give injections for 10 to 15, 10 to 12 days, after which we go for egg retrieval. After egg retrieval, the sperms are selected and we go for ICSI. After ICSI, the embryos are grown outside the body for 3 to 5 days, after which they may be frozen or transferred inside the womb. Once the embryo transfer process is undertaken, 15 days after that we'll get results. So usually it's a process where 1 month treatment is required. Thank you so much. And here's the helpline, OS helpline number where you can contact us. Any problems you want a solution, please do connect to us uh, either online or on the telephone. If you want to meet us, you can arrange a free appointment at any of our centers in Pune. We have our center at Oasis Fertility Wakad and another center at Oasis Fertility Kharadi. So please go onto the net to check for the address and you can take an appointment. Thank you so much. That's all for now. See you in yet another FB Live session next week. Thank you.